Welcome, everyone. Today we are talking about suicide prevention in youth. And we understand that this might be a difficult topic, and that is why we are here today to offer support and give some resources on how we can make talking about suicide prevention in our youth easier. Start off for some risk factors of youth suicide. There are no predictors of youth suicide, although the best predictor of future behavior is past behavior. So if a child has made an attempt before, they are at greater risk of attempting again. There are as many as 7 different factors that come together in a perfect storm. It's best to describe these 7 factors as 7 lights on a popular boulevard. To go from thinking about suicide to attempting suicide, all the lights have to turn green in a perfect storm. While we find the same risk factors present in youth as we do in adults, for example, depression, alcohol and substance abuse, previous behavior, it may be that hopelessness and impulsivity may play a larger role in suicidality. And you can see on your screen some of those risk factors in a more listed form. Loss caused by death of a loved one, it is the most impactful when the death is by suicide. A suicide in the family can have an effect on the next 7 generations. Loss of dignity, as when a child or teen is bullied, cyberbullied, or humiliated in public. The two most associated with school are disciplinary crises and academic crises. The two most associated with the home are arguments with parents and being a witness or being a victim of domestic violence. And these are some situational crises that you can see on your screen, which we also call precipitating events that may lead to a higher risk for youth and suicide.
some more there are some warning signs that you can see with your child, and with this slide it's about adolescence. Some of the warning signs, so there are suicide notes. It's not as common as one may think, but with nowadays using a lot of like technology, most of the suicidal notes, can you find them on social media such as Facebook, Snapchat, or Twitter. Those are where you can find it. And then there's our like some threats, can be direct, like I want to kill myself, I could just die, or indirect, the world would be a better place without me. Nobody will miss me anyway. Those are some examples that you may hear. There's also the plan, method, and access. The greater the plan, the greater the risk. Um, Always ask, how would you kill yourself, to assess method of access to the means of the harm. So use of gun or any other type of objects. Depression in the child. So some bipolar depression is the kind of depression most often associated with suicide ideation and actions. Depression is a risk factor for suicide, but hopelessness is a warning sign. So feeling the hopelessness. Depression in children and adolescents can look like depression in adults. So sad, irritable mood, fatigue, poor eating and sleeping, isolation, or include it can include risk-taking behaviors such as acting out, gunplay, drinking and driving, alcohol and substance use are all could be associated with the depression. Another warning sign is making final arrangements, which is kind of giving away their prized possessions, such as articles of clothing, jewelry, something that you know that's important to them. Next slide. Now, for the warning signs of youth for elementary school, in addition to those already we've discussed, these warning signs can be found in elementary school children as well. So, effort to hurt themselves, threats to run impulsively into traffic, or danger jumping from high places, or threats to jump, such as getting up in a tree or on a fence, jungle gym, throwing leg over the balcony. So engaging in these type of thoughts. Some other ones also death a suicidal theme in writing or drawing. A lot of them express their feelings through those. And also sudden changes in personality, friends, behaviors, often indicate stressful times or something recently has occurred. Next.
So, a bit of information about youth suicide. Um, in recent years, more young people have died from suicide than from cancer, heart disease, HIV or AIDS, congenital birth defects, and diabetes combined. For every young person who dies by suicide, between 100 to 200 attempt suicide. And this is actually really important to know that males are 4 times as likely to die by suicide as females. However, females attempt suicide 3 times as often as males. And the number one environmental risk factor for suicide is the presence of a gun. So if your child, you can see that they are depressed from the warning signs that we discussed in earlier slides. If you own or you have presence of a gun or any kind of um, weapon in the house, make sure to take the gun or other weapons outside of the house and outside of reach of your children. Some statistics as far as youth suicide in Los Angeles, you can see on your screen a few um, indicators or maybe behaviors that you have experienced or have done um, for um, suicide attempts. Um, Also making sure that the number of students who made a plan, made 1 or more attempts in the past year, and those that got a doctor were more in California than the national sample. And in Los Angeles, the higher number of those who reported attempting suicide, um, it's higher than compared to the national sample as well. Um, in Los Angeles, 1 out of 3 students who attempted suicide in Los Angeles um, got help. Uh, However, that means that the other 2 students um, did not get help and they just got up the next morning and went to school.
So there are some suicide prevention. So don't be afraid to talk to your child about suicide. I know can be a scary topic, but being open and having conversations. Know the risk factors and warning signs of youth suicide. So some of the ones we mentioned previously. For your response to be responding immediately. And right now we have on this page 2 crisis numbers that you can call that are available if there are any, you feel like there's possible suicide or needing extra help. So these phone numbers right here are very important. We're going to take a minute and to make sure you guys have it and be able to write it down. Okay, next slide.
Another thing that we need to talk about, and it's important to talk about, are signs of self-injury. Now, self-injury is different than the suicide attempt, but self-injury is a warning sign because it means that the child has not developed the positive coping skills to manage and cope with the difficult feelings, and it is also a warning sign that they are able to hurt themselves or put themselves in danger when we're thinking about um, suicide in youth. So some of the signs of self-injury, as you can see on the screen, is that they have frequent or unexplained bruises, scars, cuts, or burns, and um, inappropriate use of clothing designed to conceal wounds, often found on the arms, thighs, and abdomen. And you can think about this as wearing a sweater outside, even though it's 115 degrees outside during the summer. Any kind of secretive behavior, spending unusual amounts of time in the bathroom, or isolated uh, oneself. If they're always alone by themselves for a really long amount of time and they're very secretive about it. Um, and of course, if there are general signs of depression, social emotional isolation, and disconnectedness. Some of the things that we talked about earlier as well for the signs of depression. A little bit more about signs of self-injury. If they have substance abuse, um, possession of um, sharp implements, razor blades, shards of glass, thumbtacks, or clips, and we do need to look out for evidence of self-injury in work samples, in drawings, in writings, in journals. It might even be writings or drawings that they did, or art projects that they did for school, and maybe sometimes it's more of a writing for themselves or art for themselves that no one would particularly see. Another thing is risk-taking behaviors such as gunplay, sexual acting out, jumping from high places, or running into traffic.
Now we're going to focus a little bit what, as a parent, what you can do. So first is to call your family doctor. Family physicians see thousands of children over their years of practice and are good at determining whether or not there is an issue that needs treatment. The physician could ask to see your child for a physical examination and to run some tests to make sure that nothing else is wrong. Some illness like diabetes, thyroid disease, and adrenal gland disease can act like depression and that needs to be ruled out. Um, once, if those are ruled out, is to see counseling. So there, you can enroll your child in a counselor at your school. If the doctor does agree with you that there is a problem, your child should be referred to a mental health professional for further assessment and treatment. And then the counselors at your school can help with the support, adding additional support. Next. So some protective factors also is having to do with some coping skills. So to help your child develop healthy ways to deal with challenging emotions, model good coping skills too as the parent. Exercise, nutrition, sleep, avoid harmful substances, be mindful. Mindfulness is the practice of being present and in the moment. When we get overwhelmed, it is usually because our minds start to think about the past setbacks or worry about future challenges. This kind of thinking can lead to feelings of stress and even depression. If we live in the present moment, we can begin to feel begin to free ourselves of those negative thoughts and feelings and be more effective in what we are trying to do at any given moment, whether it is being more present with our friends and or family, schoolwork, or hobbies. Some other one is learn how to communicate effectively with your child. Clinical counselors at PUC or at your school can help you develop great tools to communicate with your child. Having that open dialogue, supervision, know what your child is doing, who she or he is with, and who their friends are. Be open to learn about and begin being part of your child's life, a child's everyday life. Take steps to monitor and understand media, especially social media, and understand what role social media plays on your child's life. Next. Here are some resources and some sites that can strengthen your knowledge of this topic and serve as a resource if this issue impacts your family. The last two sites deal with understanding social media and developing healthy coping skills.
We'll take a minute for you to write down some of the websites on these. And of course, we do want to remind you that if you feel or if you think that your children are at risk or displaying self-injury behaviors, uh, please contact the family doctor. If there is an emergency, make sure you call 911 or go to the nearest emergency room. And of course, we want to remind you that the clinical counseling team at PUC can provide additional support for your children. Again, we want to thank you everyone for taking the time. This is a very difficult topic to talk about, but very important to actually discuss. Thank you again, everyone.